James was walking in the streets with some friends before he suddenly fainted, prompting one of his friends to quickly call his mom. She rushed over immediately.
James, wake up, James. What happened?
Huh.
Here, have some water, my dear. What's wrong, son? Why aren't you drinking?
See,
OMG, this is worse than I thought. Don't worry, son. I'm calling an ambulance right now. You'll be fine.
So, Amy, tell me how it happened.
James has been sick for months with severe headaches and high blood pressure. But today he suddenly fainted in the streets and couldn't speak or swallow properly.
It's tough news, but it seems like your son is showing early signs of a stroke.
What? Stroke? But James is only 18. Isn't he too young to have a stroke?
Well, it's a common misconception. Stroke can occur at any time regardless of age, gender, or race. That's why it's so important to recognize its signs to avoid being caught off guard.
Wow, I see. Could you please explain the signs and symptoms of stroke to me for a clearer understanding?
All right, I'll be revealing the 7 surprising signs of stroke that can appear a month before they happen. From dizziness to balance issues, these signs are often overlooked as something else, yet they can significantly affect your daily activities.
Interesting.
I'll also explain how to easily recognize these signs, so stay tuned until the end to learn how to effectively prevent strokes before they occur.
All right, doctor, I'm all ears.
You mentioned James has been experiencing high blood pressure, right?
Yes, doctor.
That's one of the first signs of a stroke.
Really?
Yes, it is. High blood pressure is not just a symptom, but also a significant risk factor for stroke. Most people who experience a stroke for the first time had high blood pressure beforehand.
So how exactly is high blood pressure linked to stroke?
When someone has high blood pressure, their heart must work harder to pump blood throughout the body. This can gradually weaken the blood vessels in the brain, increasing the risk of rupture. It can eventually lead to a hemorrhagic stroke, which is internal bleeding in the brain caused by damaged blood vessels.
Wow, that's serious.
I know, right? But the next symptom is equally concerning.
What is it, doctor?
It's called balance problems, which can manifest as dizziness, vertigo, and lightheadedness, making it challenging for a person to maintain balance. Some people may experience sensations of spinning or swaying, even when standing still. Others may stumble or fall while walking or standing due to difficulty coordinating movements.
I think I've noticed this symptom in James just a few days ago. But what causes this problem?
This occurs when blood flow to the cerebellum, a part of the brain responsible for coordinating movement and balance, is disrupted. Since the cerebellum relies on signals from the brainstem and spinal cord to maintain balance, interruptions in blood flow can disrupt these signals, leading to problems with the vestibular system, which is responsible for balance and spatial orientation.
Oh, what about headaches, doctor? James always complains of severe headaches, and I don't know why.
Stroke-induced headaches are often described as the most severe headache a person can experience. They can feel like intense, crushing pain, sometimes centered around the eye sockets or the back of the head. These headaches typically start within 7 days of the stroke and persist until it happens.
That sounds really painful. Oh, my dear child.
Yes, it is indeed painful. This headache is caused by changes in the blood vessels of the brain that occur days or weeks before a stroke. These changes can cause the vessels to narrow and become more prone to spasms, resulting in a sudden and severe headache.
Ooh, I see.
Has James ever complained of any eyesight issues?
Yes, he has. A couple of times, but I didn't think it was that serious.
Well, it's indeed serious, Amy. These visual disturbances can vary in severity and may come slowly or quickly. In some cases, there's a gradual decline in vision, with objects becoming increasingly blurry or dim. This makes tasks like reading, watching TV, or driving difficult. In other cases, there's a sudden loss of vision in one or both eyes.
Wow. But how does a stroke relate to the eyes to cause such a problem?
The most common cause of this symptom is a condition called carotid stenosis, which is a narrowing of the carotid arteries. These arteries supply blood to the brain. When they become narrowed, it reduces blood flow to the brain, resulting in a lack of oxygen to the visual centers of the brain, leading to visual disturbances.
Oh, I see. But how about speech difficulty? My son was finding it hard to speak after he fainted, so what's the explanation for that?
Speech difficulty, or aphasia, is another common pre-stroke symptom. It can manifest in various ways, including slurred speech, difficulty finding the right words, or an inability to speak at all. These issues can stem from problems with Broca's area or Wernicke's area of the brain. The Broca area is responsible for speech production, while the Wernicke area handles language comprehension and processing.
Oh dear. I hope there's nothing wrong with my son's brain.
Don't worry, James is going to make a full recovery soon. On the bright side, at least his face isn't drooping yet.
Face drooping? Please explain better, doctor.
Imagine looking in the mirror and noticing that one side of your face is sagging, making it difficult to smile. Your eyes may not blink evenly, and you might struggle to make facial expressions. That's what this symptom can do to people.
Geez, thank goodness. I pray my boy never experiences this. It will really break my heart.
Let's stay optimistic. The cause of facial drooping before a stroke is believed to be changes in blood flow to the brain. This alteration can damage the facial nerve, resulting in the characteristic drooping.
For me, I think this is the most terrible symptom you've mentioned so far.
Wait until you hear the next one.
OMG, what is it?
Arm weakness.
Can you explain this more?
Picture yourself trying to lift a glass of water to your mouth, but your arm won't cooperate. It's like that, a feeling of numbness or weakness in the arm. Sometimes it affects the leg. Regardless of which side is affected, the person often feels weak, numb, and stiff, making simple tasks like reaching for objects, picking things up, or getting dressed difficult. This is due to the lack of blood supplying oxygen and nutrients to the brain cells needed for arm and leg function.
That's awful.
I agree. Just as we feared, your son has high cholesterol and diabetes. These are two symptoms that can ultimately lead to a stroke.
OMG. And here I was thinking these conditions only affect older people. This is a major learning experience for me.
I'm sorry, Amy. James was fortunate today because what he experienced was a mini stroke, not the real thing. If it were a complete stroke, he could have suffered brain damage.
So what can we do to prevent a complete stroke from happening, doctor?
James is dealing with high blood pressure, high cholesterol, diabetes, and obesity. I recommend changing his diet to include more healthy foods like whole grains, legumes, and fatty fish.
All right, duly noted. Anything else?
Yes, there is. Ensure he exercises regularly, at least 30 minutes a day. This will help lower his blood pressure and improve cholesterol levels.
Thank you, Doc. I'll make sure he does.
Oh, that reminds me. Let me teach you a quick acronym to remember stroke signs. FAST and be fast.
Sounds helpful. What does it stand for?
According to the National Stroke Association, be fast stands for balance lost, eyesight loss, face drooping, arm weakness, speech difficulty, and time to call 911. And FAST stands for face drooping, arm weakness, speech difficulty, and time to call 911.
That's easy to remember. Thanks, doctor.
Now you can click on the video showing on your screen right now to watch more about high cholesterol and diabetes. Thank you for watching.